there are mechanisms of action and efficacies of various biologics. So I'm going to try this once, and then it's all yours, guys.
Okay.
Because I stayed up all night practicing.
Let's hear it.
All right, we have the TNF alpha inhibitors. That's etanercept, adalimumab, infliximab, and certolizumab.
You're doing very well. Keep
Thank
going.
you.
You're on a roll.
We have the IL-12/23 inhibitors, which is ustekinumab.
Very nicely done.
I'm going down. This is it. I'm so excited now. We have the IL-17 inhibitors, and these are the tough ones.
Yes.
The secukinumab.
Yes.
Ixekizumab.
Not so good.
I'm sorry about that. Brodalumab.
Brodalumab.
I think I did that fairly. So the one that was in the middle.
Hamburger.
Hamburger. So help me out on this. What are the mechanisms of action here? How do they differ? How do you choose among them?
Yeah, so I try to explain to patients or colleagues that we have three basic strategies when it comes to treating psoriasis with biologics. Targeted therapies to TNF, targeted therapies to IL-17, or targeted therapies to IL-23.
Okay.
That also includes ustekinumab, which is a little bit broader, blocks IL-12 and IL-23. And there's a lot of nuances that go into this. The TNFs are very effective for psoriatic arthritis. According to ACR guidelines, they're first-line therapy for people who have comorbid psoriatic arthritis. So it's often a place where we want to use those drugs. They have more complex labeling issues. They have black box warnings for lymphoma, for demyelinization, tuberculosis reactivation. Fortunately, those effects are pretty rare and uncommon. I mean, I've been using the drugs for 20 years and really can think of maybe 1 or 2 patients who've had some type of complications. So it's pretty well tolerated, especially when using it as monotherapy, single agent drugs. But then you move on to the IL-17s, which tend to have more rapid onset of action in patients, higher absolute efficacy. They also are approved, some of them are approved for the joints as well and have good efficacy in the joints. But they could aggravate underlying colitis, Crohn's disease, for example. And that's often comorbid in some of our patients. They have shared genetics.
Okay.
And the 23s are our newer folks on the block now. And they distinguish themselves by having very strong efficacy and very strong convenience for patients. Some of these other drugs are being dosed weekly or bi-weekly, as they're starting on the drug, and then monthly. The 23 inhibitors tend to be every 2 to 3 months, which is a much more convenient for patients.
If I'm a patient, I want that.
Yeah, fewer injections. Most patients will say, I'd rather have fewer shots.
You know, it's really interesting the way the human brain works. If I tell a patient, would you rather have a shot every 2 weeks or every 3 months? They'd say, well, every 3 months. If I tell a patient, I got a great drug for you, it's very safe, very effective, you just have to take a shot once a day, and did I just say once a day? Oh, I'm having a senior moment. You don't have to do it once a day, you only have to do it every 2 weeks. Well, then they're like, oh, every 2 weeks, that's fine, no problem, And so when you give them the comparison, it makes a big difference. They don't measure the absolute value of these things very well, and you can gently guide them, even the mechanism of action, to explain the mechanism of action to a patient. I mean, Joel, for a physician, that was perfect. These drugs inhibit the key signaling molecules that cause psoriasis. But for a patient, I might describe it as, well, these are all natural, organic, gluten-free anti-inflammatories that complement your natural healing mechanisms. They bring your immune system back into balance and harmony. Because I like to take a holistic approach.
It sounds like you're giving them pyramids and crystals to go home with.
It does.
It does. And it also is reminiscent of talking to patients about diabetes. I know if you, more and more now, as we look at the literature, you want to start patients on insulin earlier, and you've got to convince them to take a shot. And it's how you approach it, isn't it? It's all the same.